Let me tell you something I learned after decades in medicine that most doctors never bother to mention because it seems too simple to matter. I have watched thousands of patients walk through my office over the years, and somewhere around the age of 60, I started noticing a pattern that troubled me deeply. People would come in with skin problems, with infections that seemed to come from nowhere, with falls that changed their lives forever. And when I would ask them about their daily routines, about the small things they did every morning, I began to see the same mistakes repeated over and over again. The shower, that place where we go to feel clean and refreshed, had become one of the most dangerous rooms in their homes, and they had no idea. I want you to think about this for a moment. When was the last time anyone told you that the way you shower needed to change as you got older? Probably never. We assume that because we have been doing something the same way for 50 or 60 years, we can keep doing it that way forever. But your body at 65 is not the same body you had at 30. Your skin is different. Your balance is different. Your ability to regulate temperature is different. And if you keep showering the way you always have, you are setting yourself up for problems that could have been avoided with just a few small changes. I remember a patient, someone who had been coming to see me for years, a person who took care of themselves, who walked every day, who ate well, who did everything right. One morning they slipped getting out of the shower, just a simple fall, but that fall led to a broken hip. And that broken hip led to surgery, and that surgery led to months of rehabilitation. And by the time they were walking again, their entire life had changed. They told me they never thought it could happen to them. They had been showering the same way for decades. What they did not realize was that the floor of that shower had become more dangerous with every year that passed, not because the floor changed, but because their body changed. After many years as a doctor, I began to notice a pattern in the people who aged well and the people who did not. The ones who made it past 80 with their independence intact were not necessarily the ones who exercised the most or who had the best genes. They were the ones who paid attention to the small things. They were the ones who adapted their habits as their bodies changed. They were the ones who understood that taking a shower after 60 required a completely different approach than taking a shower at 40. And the ones who refused to change, who kept doing things the way they always had, were the ones I saw in the emergency room. Let me walk you through what happens to your body as you age and why your shower routine needs to change. Your skin, which once produced oil naturally and stayed hydrated on its own, starts to dry out. The layer of fat beneath your skin that used to keep you warm and protected begins to thin. Your sweat glands do not work the way they used to. Your skin becomes more fragile, more prone to tearing, more sensitive to temperature changes. And when you step into a hot shower every single day and scrub your skin with soap the way you have always done, you are stripping away the little bit of natural protection your skin still has left. I have had patients come to me with skin so dry it was cracking and bleeding, and when I asked them about their routine, they told me they showered twice a day, sometimes more, because they wanted to feel clean. They thought they were taking care of themselves. What they did not understand was that their skin could not handle that anymore. The hot water, the harsh soaps, the constant scrubbing, all of it was doing more harm than good. And the worst part was that nobody had ever told them to stop. Here is what I tell my patients now. You do not need to shower every single day. I know that sounds strange. I know we have been taught our entire lives that daily showers are a sign of good hygiene. But your body does not produce the same amount of oil and sweat that it used to. Unless you are working outside in the heat or doing something that makes you genuinely dirty, Showering 3 or 4 times a week is enough. And on the days you do shower, the water should be warm, not hot. Hot water feels good, I understand that, but it is one of the worst things you can do to aging skin. It strips away the natural oils, it dries out your skin, and it makes you more vulnerable to infections and irritation. The soap you use matters more than you think. Most commercial soaps are designed to remove oil, and when you are younger, that is fine because your body replaces that oil quickly. But after 60, your skin does not bounce back the way it used to. You need a gentle, fragrance-free cleanser, something that cleans without stripping. And you do not need to soap up your entire body every time you shower. Focus on the areas that actually need it, the places where bacteria and odor accumulate. The rest of your body can be rinsed with water, and that is enough. I have seen people scrub their skin raw with loofahs and rough washcloths, thinking they are getting cleaner, but all they are doing is damaging the outer layer of their skin and making it easier for bacteria to get in. Your skin is not dirty just because it is not bright red from scrubbing. Use your hands or a soft cloth and be gentle. Your skin will thank you. Now let me talk about something that makes most of my patients uncomfortable but needs to be said. The biggest danger in the shower after 60 is not your skin. It is falling. I cannot tell you how many lives I have seen completely derailed by a fall in the bathroom. People think falls happen because they are clumsy or because they are not paying attention. But the truth is that falls happen because the bathroom is a slippery, dangerous place. And as you get older, your ability to catch yourself when you start to slip gets worse. Your balance changes as you age. The systems in your body that used to keep you steady, the inner ear, the vision, the muscle strength, all of them decline. And when you combine that with a wet, soapy floor and the fact that you are often moving quickly or distracted, you have a recipe for disaster. I have had patients tell me they were fine 1 second and on the ground the next, and they have no idea what happened. What happened was that their body could not compensate the way it used to. If you do not have grab bars in your shower, you need them. I do not care if you think they make your bathroom look old or institutional. I do not care if you feel like you do not need them yet. You need them now. A grab bar is the difference between catching yourself when you slip and hitting your head on the tile. And if you think you are steady enough without one, I want you to imagine yourself in that shower with soap in your eyes, or imagine yourself feeling dizzy because you stood up too fast, or imagine yourself reaching for something and losing your balance for just a second. That is all it takes. A non-slip mat is not optional. The bottom of your shower needs something that keeps your feet from sliding, and it needs to be replaced regularly because those mats wear out. I have seen people use the same mat for years, and by the time I see them, the suction cups are not holding anymore, and the mat is doing nothing. Check it, replace it. Your life might depend on it. Might. Sitting down in the shower is not a sign of weakness. It is a sign of intelligence. There is no rule that says you have to stand for the entire shower. If you feel unsteady, if you feel tired, if you just want to be safer, get a shower chair or a bench and sit down. You can clean yourself just as well sitting as you can standing, and you eliminate the risk of falling. I have had patients resist this for years because they thought it meant they were giving up or admitting they were old, but the ones who finally tried it told me they wish they had done it sooner. It is not about age. It is about being smart. Let me talk about temperature for a moment, because this is something that affects you in ways you might not realize. As you get older, your body does not regulate temperature the way it used to. You do not sweat as efficiently. You do not shiver as effectively, and that means that extreme temperatures, whether hot or cold, can be dangerous. A shower that is too hot can cause your blood pressure to drop suddenly, and that can make you dizzy or even cause you to faint. I have had patients pass out in the shower because the water was too hot and their body could not handle it. And a shower that is too cold can cause your muscles to tense up and your heart to work harder than it should. The water should be warm, comfortable, not something that makes your skin turn red. And when you are done, do not stand up quickly. Give yourself a moment. Let your body adjust. Standing up too fast after a hot shower is one of the most common ways people get dizzy and fall. Sit on the edge of the tub or on your shower chair for a few seconds before you step out. It is a small thing, but it can save you from a serious injury. Drying off matters more than you think. After you shower, your skin is wet and vulnerable. If you rub yourself dry with a rough towel, you are damaging your skin. Pat yourself dry gently and do not forget the areas between your toes, under your arms, anywhere that moisture can get trapped. Fungal infections love warm, moist places, and as you get older, your immune system is not as good at fighting them off. Dry yourself thoroughly, but gently, and this is important. As soon as you are dry, while your skin is still slightly damp, apply a moisturizer, not a lotion that is full of fragrance and chemicals, but a simple, thick moisturizer that is going to lock in the moisture and protect your skin. Your skin loses water constantly, and after a shower, it is even more vulnerable. If you do not moisturize, that water evaporates and your skin gets drier than it was before you showered. I have seen people who shower every day and never moisturize, and their skin looks like dry paper. It cracks, it itches, it gets infected. All of that could be prevented with a simple moisturizer applied every time you shower. Let me tell you about something most people never think about. The air in your bathroom matters. If your bathroom does not have good ventilation, if the air is humid and stays humid, you are creating an environment where mold and mildew thrive. And breathing in mold spores, especially as you get older when your lungs are not as strong, can lead to respiratory problems. Turn on the exhaust fan when you shower. Leave the door open or cracked when you are done. Let the air circulate. It is a small thing, but it protects your lungs and keeps your bathroom safer. I want you to think about your feet for a moment. When was the last time you really looked at them? As you age, your feet change. Your toenails get thicker and harder to cut. Your skin gets drier. You lose some of the feeling in your feet, especially if you have diabetes or circulation problems. And if you are not paying attention, small problems can turn into big ones. I have had patients come in with infected toenails, with ulcers on their feet, with fungal infections that had been growing for months. And when I asked them how long it had been since they really looked at their feet, they could not remember. In the shower, take a moment to check your feet. Look for cuts, for blisters, for anything that does not look right. If you cannot see the bottom of your feet, use a mirror. And if you cannot reach your feet to wash them or dry them properly, get help. There is no shame in needing help. There is only shame in ignoring a problem until it becomes serious. Your nails need to be trimmed carefully. If you have trouble seeing or if your nails are too thick to cut with regular clippers, see a podiatrist. I have seen too many people try to cut their own toenails and end up cutting their skin, and that cut gets infected, and suddenly they are dealing with something that could have been avoided. Taking care of your feet is not vanity, it is health. Now let me talk about something that people do not like to hear. You need to be honest with yourself about your abilities. If you are having trouble getting in and out of the shower, if you are feeling unsteady, if you are relying on the walls or the towel bar to keep your balance, you need to make changes now. not later. Waiting until you fall is too late. I have had patients tell me they knew they should have done something, they knew they were taking a risk, but they kept putting it off because they did not want to admit they needed help. And then they fell, and everything changed. There is no prize for being stubborn. There is no medal for refusing to adapt. The people who live the longest and healthiest lives are the ones who are willing to change their habits when their bodies tell them it is time. And your body is telling you, you just have to listen. If getting in and out of the tub is hard, consider a walk and shower or a shower with a low threshold. If standing is difficult, get a chair. If your vision is not what it used to be, make sure your bathroom is well lit. If you feel dizzy when you stand up, give yourself time. All of these things are simple, but they require you to acknowledge that your body is different now, and that is not a failure. That is just life. Let me tell you something I have learned after all these years. The patients who do well as they age are not the ones who pretend they are still 30. They are the ones who accept where they are and make smart decisions based on that reality. They are the ones who say, I am 65 now, and that means I need to do things differently. They are the ones who install the grab bars before they fall, who sit down in the shower before they feel unsteady, who moisturize their skin before it cracks. They are the ones who take care of themselves in the small, unglamorous ways that actually matter. Showering is such a simple, everyday thing that we do not think about it. But after 60, it becomes one of the most important parts of your day because it is where so many things can go wrong. Your skin, your safety, your independence, all of it is affected by how you shower. And the good news is that the changes you need to make are small. You do not need to overhaul your entire life. You just need to be a little more careful, a little more thoughtful, a little more willing to adapt. I have spent my career watching people age, and I can tell you with absolute certainty that the ones who age well are not lucky. They are intentional. They pay attention to their bodies. They make changes when changes are needed. They do not wait until something breaks to fix it. They are proactive, and that makes all the difference. So here is what I want you to do. Tonight or tomorrow morning, whenever you next take a shower, I want you to really pay attention. Notice the temperature of the water. Notice how steady you feel on your feet. Notice whether you have grab bars, whether you have a non-slip mat, whether your bathroom is well lit. Notice how your skin feels when you get out, and then ask yourself, am I doing this in a way that protects my body, or am I doing this out of habit? Because habits are powerful, and they can keep us safe, but they can also keep us stuck in patterns that no longer serve us. And the shower routine that worked for you at 40 might be slowly damaging your skin and putting you at risk at 65. You deserve better than that. You deserve to feel clean and safe and cared for, and that starts with being willing to change the small things. I know it is not easy to admit that you need to do things differently. I know it feels like giving in to age, like admitting defeat, but it is not. It is the opposite. It is taking control. It is saying, I understand my body, I respect my body, and I am going to take care of it in the way it needs right now. That is strength. That is wisdom. That is what it means to age well. Your body has carried you this far. It has worked hard for you for 60, 70, 80 years. It deserves your attention. It deserves your care. And one of the simplest ways you can show that care is by changing the way you shower. Grab bars, warm water instead of hot, a chair if you need it. Moisturizer after every shower, checking your feet, being honest about your balance. These are not big things, but they are the things that keep you independent. They are the things that keep you safe. They are the things that let you live the life you want to live for as long as possible. I have seen too many people lose their independence because of something that could have been prevented. A fall in the shower that leads to a broken bone. a skin infection that starts because of dry, cracked skin, a moment of dizziness that changes everything. And every single time I think about how simple it would have been to avoid, how a grab bar, a shower chair, a gentler soap, a moment of caution could have changed the outcome completely. You cannot control everything about aging. You cannot stop time. You cannot prevent every illness or every injury. But you can control this. You can control how you take care of yourself in the small daily moments. You can control whether you adapt or whether you stay stuck in old habits. And that control, that ability to make smart choices for your body, is one of the most powerful things you have. So take it seriously. Not because I am telling you to, but because you deserve to live well. You deserve to wake up every day feeling strong and safe in your own body. You deserve to take a shower and feel refreshed, not worried. You deserve to age with dignity and independence. And that starts with the small things, the things nobody talks about, the things that seem too simple to matter. But they do matter. They matter more than almost anything else. Showering after 60 is not the same as showering at 30, and pretending it is will only hurt you. But if you are willing to change, if you are willing to be honest with yourself and make the adjustments your body needs, you can keep yourself safe, keep your skin healthy, and keep your independence. And that is worth every small change you make.